Today, we're going to chat about the link between eating disorders and irritable bowel syndrome, aka IBS. Does one cause the other? Are they always interconnected? Will we always have IBS if we're experiencing an eating disorder? My name is Sheena, and I'm a registered dietitian specializing in the care of persons with eating disorders. And this channel is all about the clinical and psychological components that go along with eating disorders and eating disorder recovery. So if you're interested in learning more about that, be sure to hit that subscribe button. So first, let's dig into what IBS actually is. IBS is a collection of symptoms where we actually don't know the etiology. So we don't actually know what causes IBS. It's kind of a blanket term from all of these GI symptoms where we're not really sure where they're coming from. And unfortunately, that often results in us shooting blanks in how we're going to treat some of the symptoms of irritable bowel syndrome. The unfortunate reality is because we don't know the etiology of IBS in a lot of cases, we're often prescribing treatment regimens that can exacerbate an eating disorder, which in essence is one of the very things that can cause IBS symptoms to begin with. If you're a professional treating eating disorders, one thing that you should know is if someone comes in with IBS symptoms, the first thing that you're going to want to do is screen for an eating disorder. Oftentimes, IBS symptoms go hand in hand with a disordered relationship with food. IBS symptoms can show up in the body in many ways. They can come in the form of abdominal pain, cramps, excess gas and bloating, diarrhea, constipation, or a mixture of both. Changes in the appearance or frequency of bowel movements, changes in the gut microbiome, or mucus in the stool. In other words, IBS is just extraordinarily uncomfortable and an extreme disruption for most individuals' lives. Having a diagnosis of IBS doesn't necessarily mean that we have an eating disorder. Like I said, there can be a plethora of causes for IBS, including using medications, illness, injury, and so on and so forth. However, we do very often see IBS when it comes to the diagnosis of an eating disorder. And some of the reasons are this: eating disorders disrupt every organ and function in the body, starting with the digestive tract. So, an eating disorder is often going to lead to delayed gastric emptying, which means that we're often going to experience bouts of constipation, diarrhea, or a intermix of both. Eating disorders often also involve shifts in electrolytes and hydration status, which can result in some of those IBS symptoms, including a disruption in how we experience bowel movements. When we have an eating disorder, our gut microbiome is also heavily influenced. Starvation has a heavy influence on the gut brain axis and the microbiome that is available in our body to undergo regular metabolic functions. A person that is experiencing an eating disorder is also experiencing a shit ton of inflammation. And that inflammation is going to wreak havoc on our gut and the way that we feel in our body, which can manifest as IBS symptoms. In other words, when we have an eating disorder, our body is often so inflamed from those critical levels of malnutrition that when we put any food into our body at all, it produces an inflammatory response, which can produce all of those symptoms of IBS. The unfortunate reality is that many well intentioned providers that are not well versed in eating disorders and eating disorder recoveries will often prescribe an even more restrictive plan when they're trying to treat the symptoms of IBS. Many protocols that are often prescribed for IBS, such as a low FODMAP diet, can further exacerbate the symptoms of this condition and the eating disorder itself. Symptoms of IBS will not go away until you treat the underlying condition, which is your eating disorder. It is important to know that when you're in recovery from your eating disorder, those symptoms of IBS will feel like they're getting worse. This is normal. This is mandatory as part of the recovery process. And this is because our body is again learning to digest food properly and utilize those muscles of the digestive tract. If you found this video helpful, please consider liking, subscribing, and sharing with a friend.